One of the biggest problems of the organ donation system is society's lack of knowledge about it. In 2014, more than 70,000 people waited for kidney, liver, lung, heart, pancreas or small bowel transplants in the European Union. Because of the shortage of donor organs, 12 people die every day. Information about organ donation. How does it start? Those patients who suffer severe brain damage are transported to hospital. After extensive examination, medical professionals do everything to save their lives. During the following days, family members visit and inquire regularly so they can be continually informed about the state and change of the condition of the patient. What is the most difficult part? As a relative, we naturally hope and wait for an improvement in health. One of the most difficult moments in our lives comes when we are told the worst. Our loved ones pass, become brain dead. Often, this is the first time we hear about the possibility of organ donation, when a deceased, heart-beating donor could save another life by donating his organs. These conversations are emotionally demanding due to the nature of grief, so medical professionals prepare for these situations and make all efforts to support the families. After providing as much information as possible, medical professionals give time and opportunity for the family for understanding, to formulate questions and answers, and express their feelings. Besides the tragedy, it is also difficult that the relatives feel, as the deceased cannot be asked, the burden of decision when it comes to organ donation. As a family member, they have to respect and act according to the will the deceased expressed during his or her life. What does it mean that the body of the deceased is respected during the process of donation? Organ procurement with the purpose of transplantation is performed in a sterile environment in operating theatres. At the end of the operation, the cuts on the corpse are stitched together to reconstruct the body externally. Therefore, organ donation does not do harm to the integrity of the body and does not influence the European traditions during burial. Open coffin funerals are also possible after organ donation. If we make an active decision about organ donation today, it can unburden our families and, in a given situation, save lives.